Hello everybody, I'm Dr. Tanya Jain, and today I'll be talking about approach to viral retinitis as a part of the Ocular Emergencies and Trauma Initiative by YOSI. So the most common etiologies of viral retinitis include HSV1 and 2, varicella zoster virus, CMV, or Epstein-Barr viruses. So they cause acute retinal necrosis, progressive outer retinal necrosis, CMV retinitis, or post-fever retinitis. These are all conditions which resemble each other a lot, and we need to diagnose them correctly and start treatment immediately and manage them well in order to get good outcomes. So first, I'll be talking about acute retinal necrosis. So ARN is mostly caused in immunocompetent patients. Since these patients are immunocompetent, they mount a good amount of vitreous inflammation, so you see a lot of reaction in them. The most common cause is varicella zoster virus. If in immunocompromised, it could be HSV or CMV. So, lot of inflammation along with these wedge-shaped yellowish lesions, which are usually located in the periphery. So, they may be associated with some amount of vasculitis or optic disc swelling. So, but we need to look out for these wedge-shaped lesions, usually in the periphery. The diagnosis is clinical. However, we can confirm it with a AC tap. The therapy includes immediate intravitreal injections of antiviral, usually ganciclovir along with DECA, along with systemic antiviral therapy, usually preferred as valaciclovir or acyclovir firstly in the therapeutic doses and then in the maintenance doses. Corticosteroids may be given under the cover of, however, of only of antiviral therapy, not alone and not if you're in doubt of the diagnosis. Sometimes surgical intervention may be required since they are prone to a lot of reg RDs due to the necrosis in the retina, which may be associated with them. So these are the doses. If anyone wishes, they can just pause and see the doses for these antivirals. This is one of our patients who presented with this peripheral, you can see wedge-shaped lesions, retinitis, and started them with therapy of oral and intravitreal antiviral agents and steroids, and you can see how well the lesions have healed. And in this patient, we have done a therapeutic barrage laser in order to avoid retinal detachment. So we need to differentiate between ARN and PORN. So ARN is more in immunocompetent patients, PORN more in immunocompromised patients. PORN lesions are usually in the deep retina, ARN are usually full thickness. ARN are usually in the periphery, PORN are usually in the posterior pole with less inflammation and rapidly progressive. So these are very representative pictures that you can see. Now coming to CMV retinitis. CMV retinitis usually of three types: classical, indolent, or frosted branch meningitis type. So the most common to remember is the classical form, which is known to have a pizza pie or tomato ketchup kind of appearance with posterior pole retinitis lesions along with lot of hemorrhages. Again, it is a clinical diagnosis. PC tap can be done to confirm. So ganciclovir intravitreal is the therapy of choice along with valganciclovir oral antiviral in therapeutic doses. Sometimes foscarnet is given, however, not very readily available in India. So this is one of our patients who presented with this classical tomato pie posterior retinitis lesions, and you can see that he also had associated frosted branch meningitis type of picture. We treated him with intravitreal and oral Valgan and intravitreal ganciclovir. Patient responded very well to treatment. Another modality is post-fever retinitis. It can be caused as a direct invasion to pathogen or sometimes indirect immune-mediated response, caused usually after 4 to 6 weeks of febrile illness. Bacterial or viral causes, most commonly post-viral chikungunya, dengue, West Nile fever, or Zika viruses. So the treatment of choice is treating the underlying infection if with antibiotics. sometimes doxycycline, and along with responds very, very well to steroids. Sometimes, if there is neovascularization, anti-VEGF may be required, as in one of our patients, where we gave him steroids along with one shot of bevacizumab for this neovascularization, and the patient responded well. The other one had VH. This patient also responded very well just with oral steroids. So these are just some articles for further reading. Thank you.